So Dr. Stamp, welcome.
Thank you. Thank you for having us here, Commissioners, this morning. Again, my name is Dr. Maria Stamp. I'm the Porter County Health Officer. I have a number of people from my office here with me today. And so we may have, depending on the questions that are being asked, we may have some others who might be able to ask questions come up and do that. But I would really like to introduce to you today our Director of Emergency Preparedness for the Health Department. This is John Heisowitz. He has been with us since the end of last summer. John comes to us from working with Porter County's EMA under Lance Bella. He also is a medical transport nurse and has a lot of experience in nurse education at healthcare systems in the region. We have been really happy to have him with us, and this is exactly, these kind of situations are exactly the reason we have an emergency preparedness division in our public health department. So with that, I'd like to hand this over to John, who will give our presentation, and then we will both be happy to answer any questions you have, because I'm sure there will be quite a few.
Welcome, John.
Good morning. How are you?
Good morning.
All right. So first thing I want to start off with is the current, and this is as of this morning, current Indiana statistics. So right now there are 30 positive cases in Indiana. Right now we've had a total of 2 deaths, one which was down near the central part of the state, the other one that was in Johnson County. So no, right now, as of right now, there has been no deaths in the northern part of the state. 159 people have been tested by the state. As you can see on the illustration, we have two cases right now in Lake County. We have one LaPorte County resident that is ill and hospitalized. We also have one that is in St. Joe County, and then one further out towards Noble County. Probably the biggest concentration is going to be Marion County. They have a total of 9 cases there. All right, next slide. So some key points that I want to point out. Basically, public health efforts at this time were basically focused concurrently on, obviously, working on containing the spread of the virus. So all these interventions that are being done, the social distancing, the closing of non-essential businesses and entities, that's all in an attempt to basically limit the virus. Right now there is no vaccine or antibiotic, any kind of medication right now that has been approved to treat COVID-19. One of the things that they are doing some investigations on some of the antivirals to help shorten the length of the virus, but those are all right now in development. So basically these non-pharmaceutical interventions, these are actions that we're taking to basically limit the spread. As a virus, there's being no antibiotics available, basically a virus just has to run its course. And so by limiting our contact with individuals is going to limit the spread. So basically those social distancing and closing of businesses, limiting things down to the minimum will help. Next slide. All right, so just a few facts about COVID-19. Basically, it's spread person to person by respiratory droplets. So sneezes, coughs, things like that. If you're not covering your sneeze, your cough, you're not using the crook of your elbow, then those particles can end up on surfaces and live there for some time. Then you go ahead and you touch the surface, you touch your mouth, things like that, and then that's where people get sick. It is spread by close contact, so it's got to be generally within 6 feet. For a prolonged period of time. Basically, the infection includes sputum, which is the kind of phlegm that you have in your throat. Could be blood or those respiratory droplets that we talked about. Right now, the CDC is indicating that the current incubation time is median average is about 5 days, but can be anywhere from 2 days to 14 days. It all depends on the individual's level of health. So if they have, if they're immunocompromised, if they have other medical conditions, and the ones that we're seeing is heart disease, lung disease, if they have cancer, diabetes, all of those predispose them to a greater chance of contracting the disease quicker. One person can infect anywhere from 2 to 3 people, and mortality rate right now is what they're reporting is anywhere from 2 to 3.4%. So the mortality rate is very low. However, obviously the infectious rate is very high. Next slide. So, like I said, incubation period about 5 days. What symptoms are we basically looking at? Most people, anywhere from 83 to 98%, typically have a fever. 46 to 82% have a cough. They may have the body aches or fatigue. That's anywhere from 11 to 44%, and then shortness of breath, 31%. They also may be bringing up sputum, which is your phlegm. They may also have headache. They can also be coughing up blood or have diarrhea. And diarrhea and nausea seem to be presenting with the respiratory symptoms in the early stages. Next slide. So right now, to try to put your minds at ease a little bit, despite the gross numbers that are occurring throughout the world, 80% have mild cases. Right now, it is varying, as far as illness and mortality. What we are seeing over in China was predominantly the very old. In Italy, we are seeing some younger cases. They're not quite sure of that. They don't know if maybe the virus mutated a little bit, but those are things that they're looking at. About day 8 is really when the patient starts to have like the shortness of breath, the difficulty of work of breathing, and then by day 9 is usually about the time that they get admitted to the hospital with some sort of pneumonia. The older patients obviously are going to be more at risk. Your younger patients are going to be more at risk just because their immune systems aren't as good. Next slide. All right, so of those that are actually hospitalized, 17 to 29% are developing ARDS, so that's an acute respiratory distress syndrome. So what is that? Basically, when a patient gets like a pneumonia or they become septic, they can go into ARDS. And ARDS is basically a condition where essentially down in your lungs you have little grape-like sacs, and that's where you oxygenate your blood. Well, what happens is between that grape-like sac and the capillaries that run past that grape, which is the alveoli, essentially fluid builds up in that area. So it's very hard for the oxygen to move across the membrane, and that's where we run into problems. It's very hard these are the people that have to go on ventilators. 23 to 32% require ICU level support. So because of that need for mechanical ventilation on a ventilator. Some other things that we are seeing: secondary infection. So this virus works so that it compromises your immune system, and then if there's other bacteria that might have been growing on your skin or other places that just hasn't manifested itself, then that infection, whether it's bacterial or fungal, takes over. We are seeing heart problems. We're seeing where the heart goes into arrhythmias, where it's an abnormal beating of the heart. They go into hypovolemic shock, where their blood pressure is very low, and as a result of that, that puts them into kidney failure. So you're seeing patients that are going on dialysis. Next slide, please. So, like I said, 80%, majority of patients are well. Biggest thing that the State Department of Health is recommending is that we give the patients that are being monitored masks from home, with instructions basically that latent period, anywhere from 5 to 14 days, they might start to see that onset of symptoms. And so at that point, that's where our epidemiology nurse is keeping in very close contact with these individuals to monitor: are you having fever? Are you having cough? Are you having diarrhea? Are you having nausea, vomiting? The hospital discharge, they'll discharge the patient. Basically, they want to make sure that the patient's still maintaining good self-quarantine, hand hygiene, cough etiquette. Just because they get discharged from the hospital doesn't mean that the virus is completely gone. You still have what's called viral shed, and so they have to be cautious a few days after. And then to return to the hospital if symptoms are getting worse. And then, of course, calling ahead to make sure that they're not walking into the emergency room or an urgent care center and contaminating that area. Next slide. So what is Porter County Health Department doing? Well, these are our objectives right now. Basically, it's public education. We are providing relevant, up-to-date information as it develops, basically on our website. We're also fielding anywhere from 50 to 60 calls a day with concerned citizens on questions on what they have going on with them. We're also doing monitoring. So we're collaborating with CDC, the State Department of Health, and then Porter Regional to basically monitor these infected individuals and if need be, get them to the hospital to get them admitted. We also perform epidemiological investigations. So those that do test positive, what we're doing is we're trying to identify how did they come into contact with this organism? Who lives in their house? How much close contact have they had? Where have they traveled? What means of travel did they use? So we can start identifying and notifying the various entities. And then obviously we're doing a consulting role. So we're doing working with long-term care facilities, giving them the guidance that we receive from State Department of Health, CDC. We're working with the prisons and juvenile centers, fire, police, and EMS, and then the Small Business Association. Next slide. So as far as public health, I pulled this off on Sunday. As you see on our website, we do have information that and resources from the CDC. We do have information about the social distancing practices. And then the current patient that's from LaPorte County, our press release is listed there under county reported cases. Although they are hospitalized at Porter Regional, this patient is a LaPorte County resident. Next slide. As far as monitoring is concerned, right now, since the beginning of this outbreak, we've been monitoring 19 individuals so far to date. Currently, right now, Jessica, who's our epidemiology nurse, she's been monitoring 12 individuals right now who do have the signs and symptoms. 4 have been tested, 2 have turned out to be negative, and 2 are still pending. We do have one of those that have been tested that is immunocompromised, so obviously we're watching that individual very closely. And then obviously, with the numbers that have been coming in, the state can't monitor everybody now. So they've tasked our county to basically, you watch yourself, and we're going to want basically just keep an eye on those that are only positive cases. So Jessica's been doing a great job with that. Next slide, please. So what are some things that she does? So when she gets in contact with these people, she's trying to find out if they're a person under investigation, where have they traveled? What contacts have they had, both before, during, and after symptoms? Do they have individuals in the household that they need to be concerned about? Young and old. Have they sought out medical care? And if so, what pre-existing conditions might they have that would basically make them a candidate for getting this organism much quicker? And then obviously what signs and symptoms do they have and when did it all start? Next slide, please. So this is a timeline as far as our consulting and what the health department's been doing. So starting on March 2nd, when things started really ramping up, we met with the Porter County, the county council, and gave them an update, kind of answered what questions they had in regards to what was going on, and kind of what our plan was going forward. On March 12th, I met, I sent out guidance to our sheriff regarding the newest updates for the prison and juvenile centers, so he can basically maintain that social isolation of his inmates. On the 13th, Dr. Stamp, Letty Zapata, our health administrator, Connie Rudd, who's our director of nursing, and then Jessica, all met with Porter County School Superintendent to kind of give their recommendations as far as what should be occurring within the school system. This Sunday, I actually was on a conference call. District 1 Incident Management Team is talking about activating an ESF 8, which is public health, Emergency Operations Center at the Gary Regional Airport. As we are a partner of that District 1 team, some of the things that we are hearing is basically no one's coming to help us as far as resources. So we're not going to get help from Chicago. We're not going to get help from Indianapolis. Everyone has their own things going on. So we have to work together as a district to basically make sure that we're utilizing our resources the best we can. And the best way to do that is stand up an emergency operations center so that we're making sure that everyone in the district is taken care of. Next slide. On the 16th, we met with fire, police, and EMS, consulted with them to basically give them the newest updates as far as what is going on with EMS and dispatch instructions. We've kind of worked out a plan as far as those patients that actually present to via 911 and how they're going to handle those cases. At that time, they did let us know of their critical need for personal protective equipment. As a result of that meeting, we sent guidance down to the state that we are in need of PPE. Of course, today we're here meeting with you. Tomorrow I'll be attending the District 1 Healthcare Coalition meeting. We were going to probably stand up that EOC here in the very near future. We're also reaching out at that meeting to our long-term care health partners, hospice and home care partners, so they know what to do as well. Next slide, please. We'll have that meeting in the afternoon tomorrow, and then come April 8th, we will be doing a pod exercise. Now, this was a previously scheduled exercise. Despite things that are going on, we are still going to proceed as scheduled. The whole idea behind pod is in the event that if this was an organism that could be taken care of with a immunization or antibiotics, the whole goal is the health department would stand up with the assistance of the EMA, and we would go ahead and distribute those medications to all of Porter County. Next slide. All right, so right now, as far as testing is concerned, that becomes the big question right now. So we are working collaboratively with all of our District 1 healthcare coalition partners. Since we are a vested partner, we are working with them, and of course, the State Department of Health. Multiple requests have been made for specimen collection kits, or I should say supplies, I won't call them kits, and as well as all of District 1 partners have made similar requests. As you can see in red, no supplies have been sent by the Indiana State Department of Health as of today. They've acknowledged the request, nothing has been sent. We have reached out because of that situation. We've reached out to private lab corporations to ascertain whether or not we can obtain supplies so that we may possibly start drive-through testing. And what we're waiting on right now is pricing from our vendors to see whether or not this is going to be something that will be feasible. My understanding is the supplies are not that expensive, but the testing of the specimen is. Next slide. So on yesterday at 2:50 p.m., I sent a emergency email to Megan Little, who's the Director of Emergency Preparedness at the Indiana State Department of Health, notifying her that right now all Porter County fire departments, police departments, EMS, and the health department have less than 96 hours of personal protective equipment. After meeting with the Fire Chiefs Association, Porter Regional EMS, they're in need of severity of gloves. That is most needed, in addition to masks. We did update our status in EM Resources, which is a state website that's monitored by the state. I was acknowledged by the state that they forwarded on a request to their logistics section, and I think my understanding is all of this is being tabulated so that the strategic national stockpile can be released. Next slide. All right. So what are some things that the public can do? Actually, let me just one point on that, the previous slide. So I've been working with very closely with Director Bella from the EMA. So we sent off the request for resources. Director Bella has sent out basically supply requests from each department head, what they're in need of, how much gloves they need, how many masks they need, how many gowns they need, those different things. So when we do receive the requests, and we do receive possibly the strategic national stockpile, then we already are in a supply of that information, and we can start notifying those department heads, please come up and pick up your PPE so that your individual can be protected. So most important thing, what can the public do? Well, right now they can basically stay home unless they're seeking out medical care. You can separate yourself from other people and animals. You can call ahead before going to your physician, your urgent care, your hospitals. Wear a face mask if you have one. Cover your cough and your sneezes. Wash your hands often. That's probably the biggest thing that you can do right now. Avoid sharing personal items like toothbrushes and combs and things like that in your household. And then clean any high-touched areas. I know the facilities director passed out various disinfectants to all the different departments, which is a great measure. So we applaud them for that. And then obviously monitoring all your symptoms and reporting in. Next slide. So this time we'd like to take any questions that you may have.
You said there was 2 deaths in the state of Indiana.
Correct.
Do you know the ages of those 2 individuals?
I know the one in Johnson County was reported as being over 60, and the one in Marion County, I am not certain. I don't know the details. Also over 60. Jessica knows.
And do you have any information on test costs?
We're looking into that right now. We've reached out to 3 different vendors to try to see if we can, obviously get the best price.
Are we set up to do the drive-through testing if we are able
So,
to require tests?
Let me, we've been talking about this morning. If it's okay for me to give details, we've spoken with LabCorp and Quest. And they're the ones that are available for us to get set up with online right away. The Quest for LabCorp, or I'm sorry, the supplies from LabCorp, I should say the tests from LabCorp are the most cost effective. Supplies for collection of samples they give those to you. But then they charge, I believe it's just under $52 per test. We understand that Medicare is covering, there is a CPT code, which is a national code that allows for billing of specific tests. So there is a CPT code that is used for this specific COVID-19 test. And that, as far as we know now, Medicare will cover that. We don't know about other insurances. So we are looking to potentially, they are willing to get us set up with a small number, about 5 specimen collection sets, and then as we use those, they can get us more. How best to use those, we're still considering. It would be wonderful if we could test everybody in the county with a fever and a cough. But we're just not at that point right now. So we need to test those who are at highest risk, who are taking care of people at highest risk. And those are our biggest priority right now. The hospital is testing according to the state guidelines. They have mostly, with their tests, used the Indiana State Department of Health. So the State Department of Health is getting some testing supplies to the hospital. But they are also utilizing a commercial lab in addition. The turnaround time is a little bit greater, longer with the commercial labs. So LabCorp and Quest, as we were told, it's about a 4-day turnaround time. The State Department of Health is a 48 to 72 hour turnaround time, so a little faster. We would, be happy to investigate other options as they become available. The people that we are thinking we would have priority in testing, because the hospital is testing those who come in who are gravely ill. Those who need to be admitted are being able to be tested. So we would like those patients that are clients that we are monitoring so who have come from level 3 countries, we are still monitoring those patients for 2 weeks. And we, if they get mildly ill, we might not, as things currently stand, be able to test them. We might just have to say, you're sick, stay home. If you're not so sick that you have to go to the hospital, you might have coronavirus, and we kind of keep up with them daily to make sure that they aren't getting worse or need to seek medical care outside the home or outside of what we can do for them with medical advice from the health department. We would love to be able to test those people as a priority, those people that have traveled overseas recently or are living in a house with someone who's traveled overseas recently and is sick. Drive-through testing is an option. We are considering ways to do that. There are concerns though. For instance, there needs to be enough airflow. We were thinking about our own county's garage, which is, we're concerned that the be able to drive through and turn around and go out. I think the county's garage is not logistically a great place for that. And also you get exhaust buildup and of people potentially waiting for testing. And the airflow is not ideal. So we were thinking of some other options, and we're currently working that out. We need to speak with, of course, some governmental agencies to be able to get permission to use places, yes.
The garage is used for the emissions testing sites. The one in Valparaiso, they have garage doors on both ends of it, and they can open them and close them at will. That would be a perfect.
That's actually a great suggestion that we hadn't thought about. That has really good airflow, and
Yeah.
they are used to dealing with exhaust kind of issues on a regular basis. We will look into that. That's a really good idea. It's nice to be able to have something covered so that if we are able to test on a day where the weather isn't ideal, at least we're not being rained on
Right.
during the testing. We need to work out kind of protocol to make sure that our health department employees are not exposed or unduly exposed. We do have some PPE that is we can use for this for testing, but we need to update our education of whoever is going to be the one that is going to be doing the testing. We'd like to keep it down to 1 or 2 nurses at the most who are actually exposing themselves.
Dr. Stamp, is there any concern, because, I mean, first of all, I think unless people aren't clear, we would be acting as a collection site, not as a testing site.
That is correct.
So whatever specimens are collected at whatever location, those specimens are then mailed out, because the two labs that you're talking about, they don't have a lab here in Northwest Indiana. They have to be sent out of state.
Correct.
So the concern is putting. How do you deal with that if it's running through the mail? I mean,
it actually with these labs, they are using courier for this specifically. So I don't believe that it's actually going through the mail. I don't know what happens when it's picked up by the courier. That's a good question. But then the lab takes their kind of responsibility for that.
yeah. I didn't mean to say. I didn't mean to say the mail.
Well, sometimes we do
couriered,
send things
it's
through the mail,
couriered
so that's a
off-site.
reasonable thing to say.
Yeah, it's couriered off-site. Yeah.
Correct. Then we are handling these specimens, or intend to handle these specimens, just like we would any other infectious specimen in the plastic bio bags, and take those precautions as we would with any other kind of contagious specimen.
As these test kits start becoming available, are you thinking that the hospitals here would be the ones that would be setting up these drive-through things too? Because this is, to a certain extent, covered under people's health insurance, right? And that's who our provider is in this country. And I just didn't know if you had been talking to the hospitals in Porter County to make sure that when this does happen, we're sort of preparing for, they are preparing for these drive-through type situations?
Absolutely, that's a really good question. I believe all the hospitals in the district, at least all the major healthcare systems, are setting up to be able to do outside drive-through testing when testing is available. I know we're really happy about that.
Okay.
Do they have any idea when they're looking at more testing becoming available?
Right, it might be a week or two. They are still looking out into at least next week for this, but they are preparing. They have their little clinical tent, and they are working on the logistics and protocols for how to do this and increase the testing.
So in the
for the
meantime,
community.
before we have the tests, how are we figuring out who to monitor? It's
Right.
really hard to manage it when we don't know for sure.
Exactly. So we field phone calls from people who have come back from traveling abroad, because that was just this past week that that people from Europe have been rushing
they're
to
coming
come
to
home. And we have added, the slide said Jessica had been monitoring 12 individuals with potential travel related exposures. We're actually up to 18 or 19 now. So that is one of the ways we're finding out. And then we are also kind of working with the hospital. We're in close contact with the infection control directors at the hospital to kind of know where people are in the system in terms of if they have COVID-19, where they are in the hospital, where they are at home, and then we can kind of monitor those people, and if we can, kind of do some epidemiological work to figure out where exposures might have been in the community and really contain it as best we can. The idea with this is we would love to keep it out of our county. That is really not feasible in this current situation. So the idea is to minimize the exposures and slow the spread of the virus so that we have ICU beds available for those people who need it when the time comes. So that's really been our focus, and the whole point of keeping people home is to minimize their exposure and slow down the spread of the virus.
Of course,
Yeah.
one of the arguments I keep hearing is, well, there's no cases in Porter County, so why do we have to stay home? But there's only been 4 people tested.
There
And
have
so-
been more than 4 people tested.
Oh, I thought that was part of the presentation.
Right, so there, as far as we know, there are probably 6 or 8 at least. Our numbers are still small. Some of those tests have not returned back yet, and people are likely have this and don't know it.
Wouldn't it be fair to say it's not a it's not a case so much a case as if we're going to get it, it's going to be when we're going to get it, because we're going to get it.
When we're going to see spikes in cases,
Yes.
right.
That's what a poorly.
But as the
Exactly.
commissioners pointed out earlier in our presentation on this was, and it certainly sounds, this is exactly what your department has done, is we're preparing for the inevitable. And it certainly sounds like you guys have done a good job with that.
Thank
Well,
you.
one
We're
thing
working
for
on it.
keeping the curve flattened, as we've been talking about, I didn't see, but I've been reading, and I know this whole thing keeps evolving, and you couldn't redo your slideshow 200 times. But I'm seeing that younger people are not really, they're asymptomatic a lot of times, but they're carrying. And I've seen a lot of younger people out and about. A lot of parents are not seeing the risk to the older population. And then when you look at the mortality rate by age, it just really spikes up after 60 and 70 and 80. And I hope people out there that are watching this understand that their kids do need to stay home for the whole community.
Yes, the very young, the very old, because as we pointed out earlier, those are typically your demographics that don't have a good immune system. So obviously, as you see that spike up in age 60, you know, these are where all your medical conditions really start showing up over years of a lifetime. You know, the heart disease, the pulmonary disease, the diabetes, cancers.
We are seeing, you know, you'll see the young people, they'll hear about potential closures. Oh my goodness, this is the last time I can go out to eat.
Yeah.
My goodness, this is the last time I can go to the movies. And they are trying to take advantage of all those things and it's hard to see, especially when you're young, it's hard to see that the future will go back to normal. These things will open up again. It will happen. These measures may last for a while, but life will go on when this is done, and it's hard to get young people to see that. So, yes, I would encourage our teenagers and young people who are out of school right now, especially to lay low, stay home. Avoid large gatherings, certainly really avoid gathering in more than groups of, I would even say 3 to 5.
Like common sense decisions.
And then one last thing I saw that was different on what the public can do than it was just a little different than some of the things I've been reading. It recommended wearing face masks, but I've been kind of reading the opposite.
Well, that was guidance that came from the State Department of Health, so I would just follow, you know, we're just providing whatever guidance that they are putting out, whether it's the State Department of Health or the CDC, that came straight from their slide deck.
So face masks for anybody who's ill that has to go out for some reason, seek medical care, that kind of thing, we recommend not wearing face masks if you're well. Because they don't really protect you that much, and it causes confusion as to who's really to take a wide gird, stay away from. If someone has coronavirus and is isolated in their house, if they live with other people and have to be in the same room as them, that is an exposure to the people they live with, and a face mask is beneficial for the person who is ill to prevent spread to their family members or the people they live with who are well. Really, the ideal thing is to be by yourself in a room with your own bathroom, as you know, when that's possible.
Okay, thank you for clarifying that. And then the one other thing I noticed was animals.
We all kind of laugh about that, you know, hugging your dog or whatever is going to get you coronavirus. But we have to remember that this COVID-19 came from an animal vector. So they're thinking it came from, I can't even pronounce the name of the animal, but through bats. They think that's where the reservoir is, and then came from a wild animal at a wet market in China. So we don't know really what the potential is for spread to and from animals. It was recommended on the CDC website that if you are diagnosed with coronavirus, not to be hugging and loving and cuddling on your animals. Even though we don't think that dogs and cats are particularly susceptible, we have not seen cases of that in the United States, and really they have not reported that worldwide. It is always, if you are playing with your pets and whatever, it's always wise because they do carry bacteria and other infectious agents to wash your hands after you are handling animals.
I don't think my dog's going to understand the social distancing.
I was thinking more of your cat.
No, the cat don't care.
The dog is
I was thinking
quarantined.
he's snuggling.
That's all the questions I have.
Yeah. Well, it's got to be a challenging time, especially, you also have to look at all the HIPAA rules and the HIPAA laws, and this type of situation sort of is counterintuitive to that. And I know you guys are walking quite a tightrope when it comes to those type of things, and forever be diligent, I guess. One of the questions that I'd like to circle back to, and it is part of EMA and Lance, You know, I was talking to Lance on the phone yesterday, and you talked about the EOC up at Gary.
Yes.
And Lance had said that at some point in time, we may have to circle back and look at Porter County and setting up an EOC for our EMA department.
Sure.
If we so choose to do. And I just wanted to let that, I didn't tell anybody the conversation I have. Lance, do you want to just come up here briefly and just talk about that, just briefly? Not trying to take over the presentation, but I thought that was an interesting thought or whatever. So good morning, Lance.
Good morning.
How you doing?
Good.
Good.
So as we see a need, and we're going to have a meeting later at EMA to discuss this, you know, what nutritional value would we bring to the situation by gathering information, which as John said, we're getting requests from the fire departments, police, what do they need? And so we're gathering that, compiling that, but trying to organize that, track that, and then also track. We have 2 of our EMA personnel that are dedicated to the district EOC, so we're trying to augment and help them. Deputy Director Carlo was there Sunday, and then last night trying to help them set some things up. He's not going to be dedicated there, but we have 2 people dedicated there. And then we have one of our section leaders coming in today, and he's going to be installing and setting up some equipment so that we can stand that EOC up at any point in time if we need to. And during that time, we'll be discussing what information, what we want to have, what do we want to see, and then we would even invite, if need, or if it benefits them, the health department and any other departments within our government to be able to be there or have a representative there, and that way they can obtain information. So what we're trying to do is just be able to supply and coordinate as we do, but to supplement and assist and enhance the effectiveness of the health department for what they're doing. That way, if we can make their jobs easier with some of this, we're going to try to do that because they've got enough going on the other end. So.
Yep. Thank you, Lance. And then the other thing I'd like to point out is, you know, our EMA, Porter County has its own EMA department, but we are part of a district which includes Northwest Indiana. So we work as a group collectively for the region, but we also can pull back and work locally here. And the other, and I know this is a department over the last 3 years since we've hired Lance that has made a lot of robust progress, and thank you. But with that, I'd also like to say that a lot of part of EMA in Porter County is volunteers. And we have some people here that are volunteering their time to help come and do this. And, you know, that's public service. And I just wanted to be able to say that because I know, you know, you've put a pretty good volunteer corps together, and these guys put a lot of hours in. And they're not paid for it. And we try to give them as much gratitude up here as possible, but it never seems like enough. So I just wanted to take some time to just point that out to the folks in here that we have a very robust EMA department, and I think you've seen just by the presenter and with Lance that we got it hitting on all cylinders there, but we have a lot more work to do, and I appreciate your diligence on behalf of the county. So
Thank you.
Thank you,
Appreciate
Lance. Thank you. Any other questions? Any questions from the audience? I don't mind opening up to the public. I really don't. This is a special time. And if anybody has concerns, this is the time where you can come up and address. All I'd ask is if you come up, there's a microphone up in the ceiling there. We just want to be able to hear you. And if not, that's fine too. But
fortunately, we don't have too many public here. They listen and stay
yeah,
home.
yeah. So I don't see any takers at this time. So final thoughts and comments.
I would like to reiterate how we didn't touch on it very much about the potentially activating the Division I ESF 8, which is specifically healthcare and public health. We are excited about that. Information sharing has been a little bit challenging in the past couple of weeks. I find that I'm getting my information about the rest of the counties in the district from the newspaper. So when we can kind of have people in one location come together and share information and the status of the status of the spread of the illness and the status of the needs of the healthcare facilities in the county or in the district, and what other public health agencies are doing, maybe sharing best practices for how to go about things like testing, reporting, and monitoring, all those things, and getting a really consistent message out to the public on what's going on. I think this standing up this District 1 ESF 8 will be really helpful along those lines. So we're looking forward to that in the next week or two. I think
Correct.
they were hoping
Correct.
to do that. So
Good.
Good.
And all of this will be online, so anyone who's interested in revisiting